All right. Well, hey, thank you everybody for taking the time to join us today on our webinar on remote monitoring and coaching in today's virtual climate. Before we start, we just hope that everyone and their families are healthy and safe. So in today's webinar, we just want to highlight some of the best practices that we have found from our own work in the industry and just ways that you can utilize this data. And hopefully you can take something you learn here today back to your organization and incorporate it in your own work. So as you saw in the invitation, we want to focus on effective ways to remotely monitor athletes with basic questionnaires in regards to your athletes' health and performance while they're away from your facilities and away from the coaches. We'll be utilizing our Smartabase mobile application throughout the webinar today, which has the ability to collect this data, as well as among other things. But you can also collect this data through a number of creative ways that some of you may already be doing now. We will be able to answer questions that you may have through our chat function throughout the webinar with Zoom. And if we don't get to your individual questions, I can follow up with you individually after the webinar via your preferred communication as well. So today I'm joined by one of our lead sports scientists from Fusion Sport, Dan Duffield, to share some of his best practices from his experience working with universities, professional sports clubs here in the US and around the globe. Thanks for joining us, Dan.
Thanks for that, Charles, and thank you everyone for joining us. As Charles mentioned, today we're going to look at the topic of remote monitoring in sport. So this is a particularly important topic considering the current climate we're in, where athletes and support staff are unable to interact with each other face to face. So before we jump into the presentation and the questions that we're dealing with, I want to give you a quick overview of my background. So I'm a sports scientist. I'm not a programmer. I've been with Fusion Sport for about 8 years now. I've worked across Australia, the United Kingdom, Europe, and most recently the United States. So in my time with the company, I've worked with professional sporting teams, institutes and Olympic committees, universities in both the research side of things and the athletic side, private training companies, and military groups as well. So in this time, I've worked with over 100 organizations, and one of the key themes that's common across them all is the requirement at different times to monitor athletes remotely. I've come across a number of different philosophies in that time around athlete monitoring, and have seen an extensive amount of questionnaires during my time. So today, I'm hoping to share some of the insights with you around what we've seen at Fusion Sport in this space and some tips for designing and implementing those athlete monitoring systems. The first thing I'm going to start with is just a really brief PowerPoint just to kind of take you through what we're going to deal with today and some of the key considerations. I'm hoping that from this PowerPoint, it'll put some thoughts in your head about what you can potentially do in your own environment. And then hopefully at the end, if there's some questions that you've got, we'll be able to answer them. So just starting with the PowerPoint. So the first thing that we'll do is just talk about the topics that we're going to cover today. So this is going to be a very surface look. We're not going into really complex data science today. We're just looking at firstly, the structure of a wellness questionnaire. Then we're going to look at how we can give feedback to athletes remotely from the questionnaires that they're completing. And then finally, how we can communicate with departments remotely off the back of these wellness questionnaires and make decisions and actions off the back of that data. So the 3 points that I want you to kind of keep in your mind as we go through this in terms of designing an athlete monitoring system. Number one, it needs to be simple. When you're in a remote environment like we are now, trying to educate people and especially in complex workflows is quite a challenge. And it's something that in our work that we do with all of our clients, we find that the more complex the work, the harder it is in a remote environment. The second thing we're looking for is consistency in the data collection and in the actions that we're taking. You can't make good decisions off data if you're getting inconsistent data or you're changing things every other day. So we want to look at how we can keep our workflows consistent and make sure the data that we're getting back from our athletes is also consistent. And then finally, we want it to be informative. So we don't want to collect these questionnaires for the sake of collecting data, just so that we're ticking that checkbox. We want to be able to make decisions off that data and give informative feedback to our athletes once they complete them. So the first thing that we're going to deal with today is building a wellness questionnaire. So there's a lot of talk about the types of things that you should be monitoring at this time. What we're going to look at is some really basic things. Even before we get to that, is how long should my questionnaire be? So we want to think about how much time it's going to take the athletes to collect, and how often we also want them to complete these questionnaires. We'll then look at the types of questions that we should be using in these. So what variables we're asking them to report on, and then how we're asking those questions. And then also what descriptors we can use to assist in the athlete's answers. So whether we use number fields, text fields, how we structure the layout of it. So those are some critical parts to the building of a wellness questionnaire. What we're then going to look at is how we can then give feedback. So what options do we have to provide athletes with feedback? So the two that we're going to deal with today, and that's just the part of the system that we're using, which is Smartabase. We're going to look at an athlete dashboard, and then we're also going to chat briefly about app notifications. So giving direct flags through notifications to an athlete. We're also going to talk about the types of flagging that we can use. So how we're actually calculating what is a flag and what isn't a flag. And we're going to talk about the use of absolute flags versus more individualized flags. And then finally, we're going to look at how can I provide customized feedback, and particularly looking at using a decision tree type philosophy in providing feedback based on the results that we're getting. And then lastly, we're going to look at how we can communicate as support staff in a remote environment. So number one rule, obviously going back to those points I made earlier, is keeping things consistent, using one method of reporting in terms of, and I'm talking about questionnaires here. And then secondly, making sure everyone across your support team is seeing the same data that you are, so that when you're actioning things and you're trying to make good decisions for your athletes, you're all reading off the same report. And then we're going to look at the options for communication in that. So looking at things like team dashboards versus performance alerts. So what I'm going to do is switch over to firstly the Athlete app. So we're using today our Smartabase Athlete app as an example of a method you can use to collect data. So you'll see here we've got just the basic interface of the Athlete app. So this is just a simple home page. Now what you'll notice, a couple of features here. We'll see under the favorites bar, we've got two questionnaires right now. We've got a COVID-19 questionnaire, which is obviously quite an important topic. And then we've just got a standard wellness questionnaire. First comment I'll make about these is there's no reason they can't be together, but just for the purpose of today, I wanted to split them out so we could look at some what a typical wellness questionnaire looks like, and then maybe some specific questions that you can ask from a COVID-19 type situation. So what we're going to do is I'm just going to start by entering the wellness questionnaire. So if I scroll down, as we mentioned earlier, what we're actually going to be looking at here is how we structure this. And the first thing that I want to notice as I scroll down is just the length of our questionnaire here. So if I get to the bottom, you will have noticed that we have 5 slider questionnaires that deal with some specific wellness questions. And then we have a body diagram option here as well, with finally a comment section. So the general rule of thumb that I've talked with most of my clients about in terms of length of a questionnaire is if you want to do it in time to complete, you're looking at no more than a 30-second questionnaire. And that gives the athlete time to read the question, think about their answer, and respond. Another good thought to have in mind is how many clicks it's going to take an athlete to complete a questionnaire. We don't want them having to click all over the place and it to be quite a laborious thing for them, because you get things like athletes just scrolling through and entering the same value every single time. We want it to be simple and easy so that they can do it quickly and then be done with it for the day. So a couple of other points to, I guess, to notice here is the types of questions that we're asking. So this is a thing that I can leave up to you as you design your wellness questionnaires. You should be thinking about, what do I want to know from my athletes? And different sports will have different priorities around what they want to ask. So in my example here, I've just got a basic fatigue question, a sleep quality, a mood, so taking that psychological side in as well. One of the other things I've included, just because I understand a lot of the viewers of this webinar today are from the college space, is you can even think about something like maybe an academic stress question, or just something about how school is going for them. And then finally, a muscle soreness question. So those make up our sliders. And then again, to get a little bit more detail around soreness, and particularly this relates to prevention of injury, is, you know, what body areas are my athletes particularly finding soreness in? And you'll find that in different sports, you'll be focusing on different areas, but it just gives you that little bit of extra information and hopefully not too many extra clicks. And then finally, with the comment section at the bottom, this is a really nice one, because the athlete can actually write something very specific to you, just about maybe how they're feeling or how their training's going, that sort of thing. And that's just that extra piece of information for you. Another thing to notice is how we use descriptors in this. So across all the wellness questionnaires that I've seen a variation of just using numbers, so a scale of 1 to 5, and then you put the description of what each value means, maybe in the title, or you just say simply on a 1 to 5 scale, 5 being good, 1 being bad, how is my fatigue today? The way that we do it in the app here, and I tend to like this as well, is having the descriptors. As I scroll across, you'll notice that my descriptors are changing. And you'll also notice the color. Now, there's probably some questions to be asked about color, whether that's going to influence an athlete's response. But I think it also, in this particular case, it actually adds to it. So if an athlete is feeling good about their fatigue, they see not only the text feedback, but then also the color response. And again, I can do that through all of my questions here based on how I'm feeling. And then finally, I can click through and select a couple of body areas that I might find are giving me problems at the moment. So the last thing that I want to show in this case is, this was a very basic one. So you'll notice here, I've got a question called form view. Now, this isn't something that you would typically have in a wellness questionnaire. This is something to just make this particular webinar a bit easier. But say you wanted to have a little bit more information, or you wanted to ask a couple more questions. If I select a detailed view, what I get is I've now thrown in an extra maybe stress level question, and that could be maybe related to sports stress or something else, family stress. It could be things like a recovery question, nutrition. A lot of people like a question around sort of training readiness, that type of thing. So again, it's up to you what questions you choose and how you choose to word those questions. But as you can see, we've just added an extra question in there. And then one of the other things that we've done down the bottom here is, when I've added the more detail option here from my wellness questionnaire, I'm now getting the body areas that I select. I'm actually able to give them a rating of 1 to 10 in terms of how sore they are. So these are just some ideas for you to come up with different things that you might want to ask in your wellness questionnaires. But again, it's up to you to structure that based on your understanding of your athletes and your environment. So the next thing that we're going to do is we're going to move on and have a quick look through the feedback options that we have available. So as I mentioned, there is an option, especially in the Smartabase app, Athlete App. But in a lot of other environments, you're able to send app notifications or text message or email to an athlete that flags to them whether it's fatigue or muscle soreness or sleep, one of those things. So that's a really great option for flagging that. But typically what you want off the back of that is some more information for the athlete to act on. So the main way that we're finding our clients and organizations we are working with are interacting with their athletes is using dashboards. So what I'm going to do is I'm going to quickly load this Athlete Insights dashboard where we're pulling some data from a few different locations. And what I want to do is just talk through the structure of it and focusing on the simplicity of it for the athlete. And then also some of the potential options that you can add to these types of dashboards. So what you'll see here, we've got a very basic layout. We're using what we call tiles to provide most of the feedback in this particular view. We've taken out, in this example, any longitudinal graphs or anything like that might initially distract from that actionable information, but it is something that you can add down the line. As you can see, we've just got a current status option. So that could actually come from either your ATCs, doctors, strength conditioning coaches. If you've been communicating with an athlete and you're saying, yep, currently they're available to train. The other option for that particular value is you could just have a question in your wellness questionnaire which says, are you available to train at the moment, or are you injured, or something like that. And that can dictate the status that appears and the colors that you're getting there. The next one you'll see is mood. So there's a couple of features here that I want you to kind of look at and see if they might be useful in your environment. The use of color. So I know that in some instances, red can be quite a negative thing for people. So you might want to choose maybe a slightly different color, an orange or something along those lines. But the color itself is the indicator. So even if the athlete maybe doesn't necessarily understand exactly what it is, they can understand that that's a flag for them to act on. The use of the word declined there. So instead of saying bad or poor or something like that, it's just using the term decline. So it's decline from their normal state. And that typically indicates that they've gone down, but also it's something they can bring back if they do the right things. And then underneath, what we've done is to add a little bit of value to that. And this is, again, giving an actionable insight to an athlete, is giving them some feedback. So you can see simply there it says, and these are just generic ones. So it's up to you how you write these, but your mood is low. Remember that sunlight can dramatically improve mood. Try and get out in the sun, especially in the morning. So that's just a very basic piece of feedback. It's an actionable feedback point, and then the athlete will hopefully take that advice and do something with it. If I scroll down a little further, we've got fatigue and stress. So fatigue and stress, this is one that we've actually combined the feedback of two of our variables. But basically you can see that we've got a yellowish color for stable. So we're indicating that things are okay, you're pretty stable at the moment, but make sure you monitor your stress levels and notify staff if you're experiencing any acute distress. And then as we scroll down, we can see muscle soreness and some more feedback there. Now, one thing that we aren't going to go into too much today, but I do want to highlight is, and something that we can do in Smartabase is, we've obviously got the sleep quality questionnaire that we saw in our wellness questionnaire, but being able to tie that in with some objective data, maybe from a wearable that your athlete might be using, maybe if they're feeding that data through Apple Health Kit or any of those types of apps, you can then add a little bit more context to maybe their reported sleep by adding in that objective data. And then one other thing we add at the bottom, just as kind of a motivator or just an indicator for an athlete, is just their compliance with how often they've been completing this. And again, you could have a comment there to say to the athlete, hey, your compliance has been below 70% this week. It helps the support staff, and it will help you if you continue to fill this out daily. So that kind of deals with a lot of the just the basic layout. A couple of things I just want to talk about with how we've set the flags behind these, which I think is really, really important. So I mentioned absolute versus individualized flags. So typically what you find is if you've got a wellness questionnaire where you've got a scale of 1 to 5 or 1 to 10, you obviously want to flag when an athlete reports like a 1, 2, or 3, something very, very low based on the scale that you're using. So that would be an absolute flag where they're just entering a value and we're not comparing it to anything else except the value. That's a way that a lot of people flag, but that's not really enough. That's kind of very base level, and not many people do that. So what you need to do is we like to add multiple levels to our flagging. So we'll start at the very basic level of having an absolute flag of 1 or 2 or 3 or something like that. And then we'll include things like maybe a Z-score, where we get the average for that player over a period of time for that variable. So we might look at their mood over the last 7 days or over the last month, or even all history, just depends on how you want to look at it. And then we look at how many standard deviations they are away from their norm. So then what we do is we've got a multi-level flag. We flag if they give us a certain value of 1 or 2, and then we flag if the value they give us is significantly different to the normal value that they report. You can then have a third level to that, and again, I'm starting to just spitball examples, but you could have a recurrent decline flag. So if they've, say, one day using our questionnaire, they report a 5, and then the next day they report a 4, and the next day they report a 3. But their typical rating is kind of around a 3.5 or a 4. None of those days would flag either for an absolute or an individualized flag like a Z-score. But what we can do with a kind of recurrent decline type flag is you're basically reporting that over the last 3 days, they have trended downward. And that can just be another indication that over that period, they're getting worse. And you can do that over a 2-day period, 3-day, 5-day, week, however long you want to do that over, and just be monitoring it. But instead of just having a simple, what score did they get, you're actually creating a lot more context to the flag that you're producing. So just a couple of ideas there, and how you incorporate those is completely up to you, as we've said, but yeah, just a few options to go through. Now, for the feedback side of things, I just want to talk about how you can create some really customized feedback based on the flags that you're given. So instead of just every day giving a recommendation for how mood can be improved, so this is a really generic one that I've got in front of me here. You might have a flag feedback based off what level of flag it is. So if it's a severe flag, you might have a more severe or more focused feedback for them, or more focused actions for them. If it's maybe not even a flag at all, you might not have any feedback. If their mood says you're doing great, then it might actually just say the feedback, you're doing great, keep up what you're doing. But with decision trees, what you can do is you can say, if my mood absolute score is this, and my individual Z score is this, I want to provide this particular piece of feedback. If all my other flags are good, but I've been declining over the last few days, the feedback might be careful, you've been declining the last couple of days. Here are some recommendations to get you back into a healthy state. So we've got clients that have very basic decision trees where for each variable, there might only be 3 pieces of feedback. Some have much larger ones. And a lot of those would be related to kind of interrelating variables. So it might be if your mood and your fatigue and your sleep is low, here is a specific feedback for how you can improve in those areas just with this piece of feedback. So that's just something to think about as well, is instead of just giving very generic repetitive feedback, having very specific feedback for your athletes based on multiple variables in your wellness questionnaire can also add value to that insight, into the insights you're giving them. So as you can see, that's a really, really basic questionnaire. Other things you can add, and we didn't want to add them in today just because of the time that we've got, but adding things like maybe trend graphs of the last 7 days or last month can also be quite helpful, where they can actually look at how they've been trending for each of their variables. But if you're just looking at something very basic to start, this is probably a great way to start, just giving them colors and actionable insights. So the last piece I want to go to now is actually going into how you as support staff can communicate with each other based on the feedback that you're getting. And so what I'm going to do is I'm actually going to change my view now to the Smartabase platform. So I'm off the app, I'm in the Smartabase platform where I'm collating all of my data from my athletes from multiple different sources. So just for those who haven't seen the system before, this is an example of a homepage. So these homepages are very configurable in terms of the types of reporting that you can put there. And I think it's important that whatever system you're using, that you are able to configure what you're seeing to action the critical pieces of information in your environment or in your department. So I'm just going to go through a couple of dashboards here and just deal with them. Deal with each part of it and talk about how we can possibly go and report on these metrics that we're getting back from wellness. So the first one I'm going to look at is a group report. So if I'm an ATC, an S&C sports scientist, or if I'm head of a whole department, this dashboard, it's very basic, but it's also really, really informative. So what we've got is we're making use of some tiles up here where we're basically seeing across our squad how many people are flagging in different areas. So as you can see here, we've got 5 fatigue, 2 mood, 5 stress, and 3 muscle soreness flags. These are all quite interactive as well. So if I want to click into that, I can just get a simple list of names, and the other thing you could put beside it is mobile numbers if you wanted to call them, text them, follow up with them. So that's an option for you there. But if you want to get into a little bit more detail and see a somewhat similar view to what the athletes are seeing on the app, you can produce a simple table like this where you've got their absolute score and then you've got their flag beside them. So then you can go through your list and you can start targeting the athletes that you need to touch base with first. So that's a really good way to kind of approach this. The other option, if you have a smaller number of athletes and you want to take a more personal approach to their data, you can also produce, if I just collapse this one, we can also produce a simple individual report. So it lays the data out a little bit differently. A couple of highlights here that we're looking at is we're also incorporating data from other areas. So we've again got that availability information available. We've got a current injury. So if you want to pull through, do they have any current injuries or illnesses? You've got access to that, some injury details and maybe some restrictions, and then any comments about that particular injury. We can then see here just their most recent wellness flags. So I can go through and see the same flags that I saw just before. And this is an example of where you can have a longitudinal chart to review. So here we're just displaying training load. And then we're just seeing that over, I guess, the last sort of, 6 months. And we're just seeing how they've been trending over that time in terms of their training load. Now, getting to the key piece about how we communicate as a group. So one of the things you find is that if there's 4 or 5 people who are responsible for the same squad of athletes, if you don't have clearly defined athletes you're looking after, there's a chance that 2 or 3 of you might touch base with the same athlete. And in some circumstances, that might not be the worst thing, but I think in terms of utilizing your time well and not bugging the individual athlete, making sure that you understand maybe who's actioning certain items. So whether it's someone's responsible for actioning certain variables, maybe fatigue or sleep or stress, or whether it's just seeing a flag and being the first one to jump on it, being able to communicate that you've actually said something to the athlete or contacted them. So one of the things that we've got here is we've got this thing called department notes. And what this allows us to do, it allows us to indicate who has followed up with this athlete. So right now we're only doing this on a week, in our version here, we're doing this on a week-to-week basis, but you could actually apply this in a daily setting if you wanted. So that based on a flag that appeared, so say we've got our fatigue flag here, you could actually say as a performance coach or as part of the medical that, you know, you've touched base with this athlete, you followed up, they're not sleeping well, you've given them some feedback. And that's a really critical piece. But the other part of that is if you don't have a central system where everyone has access to that information, and that's going back to, you know, having that consistency across the group in terms of data. If you don't have that information, then you might, again, follow up after someone's already done that. So having a dashboard or a central point where everyone's able to put their notes and say, I followed up with athlete 1, made sure that their fatigue flag was sorted today. And that way you can very easily refer to that note. And if you find that no one's actioned it, you can then follow up with them. Obviously that requires as well that everyone enters their notes, but having a mechanism to do that is very important. So those are just some very, very basic ways in which, as a support staff, you can be looking at the same data and communicating the same data to each other, and B, how you can flag with each other who's following up. So again, there are many different things that we can do in this space that we won't be able to touch on today. But as Charles said earlier, we're more than happy to answer questions on maybe some different versions of dashboards that we've seen. And then, hopefully answer some of your more specific questions about your environment. Just one last thing before I finish off. I'm just going to quickly go back to my mobile app, and I just want to show you just an example of the COVID-19 questionnaire. So we just built a very basic version. A number of our clients have some far more complex ones with a lot more detail. But if I just click into my questionnaire, so this is a really, really basic one. You could include these questions in your normal wellness, or as we've done here, keep it separate. So we've just got a simple "Are you well?" questionnaire. Are you well question? Sorry. We've got symptoms, so that helps them understand. Okay, if I've got any of those symptoms, I should be answering yes to this. So now, if I answer yes, if I answer no, I'm then presented with a multi-select where I can select the different symptoms that I'm having. So again, if I go through and tick a few of those, that's additional information that I can then pass on to my to the staff as an athlete, and they can then feed back to me. And then we've also got some information here about traveling. So has an athlete traveled in the last 14 days? Yes, no. And then if they have traveled, they can actually record some of the information around the flights they've been on, whether they're domestic or international, the countries and states and cities they've been to. Well, one other thing that we've put in here is we can also incorporate links. So this link here allows us to go to a government traveler and visitor information package where the athlete can then get some information. So those are just a couple of different things that you can add to if you want to do one of these questionnaires, that you can add to it, to be more informative and allow people to do some treatment on their own, but also flagging with you the information that you need around their condition. So at this point, I just want to maybe finish off by talking about some of the additional monitoring tools that you could use in conjunction with your wellness questionnaire. So a lot of athletes today have wearables. So either it's a watch, a ring. And so one of the things that we do along with the collection of this wellness questionnaire is we would combine the wearables data with the wellness questionnaire to kind of complete the picture a little bit more. So an example that we can show you of a dashboard where we're actually kind of incorporating that information is, just go back to the main site. So one of the things is we've got an integration with Apple Health Kit. So one of the things that you can do is you can actually incorporate data that's coming in from nutrition apps, wearables, sleep apps, that sort of thing. And then you can actually present that as a staff, and you can review more objective data rather than just what an athlete's reporting to you. So again, one of the things that we've combined in this dashboard is we combine the two pieces. So we've got a very similar view to what we had before, where we've got our current status and our wellness variables. And then I'm also getting information about each of my athletes around activity they're doing, the energy they're burning, that sort of thing. We're looking at activity analysis as well. We can see here what types of activity they're doing if they're recording that. And then if I can go to a more individual level if I want to, which actually looks very similar to the dashboard we were showing on the front page there, but this time kind of giving you more of these insights and longitudinal data. So again, I don't want to spend too much time on this because that's kind of going away from the main point of our discussion today. But just to give you some other ideas, if you are getting access to this wearable data, being able to combine that and view it in the same place as your wellness data is very important too, because it just adds a little bit more context. So at this point, I might finish up there and hand back to Charles and potentially open up some questions.
Thank you, Dan. Thanks for taking us through that. It was really, really helpful to kind of learn that. If you guys had any questions, we do want to open it up to questions in regards to what we could possibly show, or any specific questions that maybe we didn't highlight that you wanted to see at the time. Feel free to answer that below. Otherwise, what we can do as well is we can follow up, and if you guys had any individual questions or wanted a little bit more information about the platform itself, definitely feel free to reach out, and what we can do is we can take you through a demonstration of the platform. Our big thing right now is, with everything starting to kind of slow down, definitely do not let working remotely be detrimental to the health of your athletes when they return for the fall and they go for fall sports. Definitely reach out in regards to this for more information about athlete monitoring. And if you guys would be more interested, me and Dan would be definitely be more than happy to take you guys through a live demonstration of the platform itself.